Leaders in Santa Clara County calling out the private healthcare systems, how they're being pushed to do more COVID-19 testing. Good evening. I'm Alan Martin.
And I'm Elizabeth Cook. We begin this half hour with KPIX5's Len Ramirez and the new public health order requiring the big hospitals to do more coronavirus testing. Len?
Well, there was quite a little bit of back and forth between the county and some of the private providers today, with the county saying that private hospitals need to do more to help the county reach its goals in terms of testing people for the coronavirus. But the hospitals are saying that the county is not doing enough contact tracing at this point to make those tests really valuable. Santa Clara County has been opening pop-up testing sites like this in response to the COVID-19 pandemic. The county has set a goal of reaching 4,000 tests per day, but the actual number of tests conducted is far lower, about 2,300 per day.
And we just can't do that alone. And we feel it was necessary at this point to issue this order so that we, again, can do all we can to protect the people of this community.
And so today, the health department issued a new order requiring all large healthcare systems in the county to offer testing to patients in their systems who are at risk for exposure or who work in frontline essential jobs.
You know, I'm not saying that they're not doing it, that these systems are not doing any testing, but they're just not doing them to the level that we really need in this county.
Testing is a good thing, but testing in and of itself is not the panacea to everything.
Good Samaritan Hospital along with Regional Medical Center are part of HCA Healthcare. Together, HCA is doing about 100 tests per day in the county, but they say increasing that number won't have an impact unless the county steps up contact tracing.
You know, there needs to be a partnership between both the hospitals, the public entities that are out there that are doing the different testing sites, in addition to the county as well. I mean, there's responsibility on everybody's part when it comes to making sure that we're meeting our goals.
Now, after that conversation, I did check back with the county, and the county says that it is doing about 170, or it has 170 contact tracers, and they say that that is enough for the number of tests that are coming in right now. So it's sort of a chicken and egg thing. The county is saying not enough tests coming in, and the private providers saying that there's not enough contact tracing. So which one comes before the other? And that's what the healthcare systems and the county are trying to sort out. Meantime, the largest healthcare provider in this area, Kaiser, said that it is meeting the county's goals of testing. Reporting live in San Jose, Len Ramirez, KPIX5.